Welcome to this video. The video is on setting up of quarantine, isolation wards or centers. My name is Florence Luganje. I am a clinical manager and a TOT in COVID-19. The objective of this module is to describe how to set up isolation wards and quarantine centers. First of all, let's just recall that an isolation facility aims to control the airflow in the room so that the number of airborne infections, particles, is reduced to a level that ensures cross-infection of other people within a healthcare facility is highly unlikely. So where should the isolation area be located? It is preferable that the isolation ward should have a separate entry, exit, and should not be co-located with post-surgical wards, the dialysis unit, the labor room, and other critical care rooms. It should be a segregated area which is not frequented by outsiders. The access to the isolation ward should be through dedicated lifts or guarded stairs. The corridors with frequent patient transport should also be well ventilated. Signage should indicate that the place is an isolation area. What layout and furniture is required for an isolation area? COVID-19 patients should be housed in single rooms. If sufficient single rooms are not available, beds could be put with separation of at least 1 meter from one another. There should be no non-essential furniture. Therefore, ensure that the remaining furniture is easy to clean and does not conceal or retain dirt or moisture within it or around it. Keep the patient's personal belongings to a minimum and keep water pitchers and cups, tissue, wipes, and all items necessary for attending to personal hygiene within the patient's reach. There should be a double door entry. There should be a changing room, hand washing station, and nursing station. The isolation ward should have a separate toilet with required cleaning supplies. What tools and equipment should be in isolation area? Changing rooms should include the following. Set up a trolley outside the door to hold unused personal protective equipment, PPE. A checklist may be useful to ensure that all equipment is available. Set up a waste disposable bin to collect the used PPEs. The used PPEs should be disposed as per facility and the MOH guidelines. Non-critical patient care equipment, for example, stethoscopes, thermometers, blood pressure cuffs, sphygmomanometers should be dedicated for the patients if possible. Peradventure that any patient care equipment has to be reused by other patients, this should be thoroughly cleaned and disinfected before use. Touch-free waste bins should be available for biomedical waste. Place an appropriate container with a lid outside the door for equipment that require disinfection or sterilization. Ensure that appropriate hand washing facilities and hand hygiene supplies are available. By stocking the sink area with suitable supplies for hand washing, you can also include alcohol-based hand rub near the point of care and room door. Consider having a designated portable X-ray and portable ultrasound equipment and set up a telephone or other method of communication in the isolation room or area to enable patients, family members, or visitors to communicate with healthcare workers. What else should be considered to ensure proper ventilation in isolation areas? 1. Ensure adequate room ventilation. If the room is air conditioned, ensure that 12 air changes per hour and filtering of exhaust air is being undertaken. Negative pressure in isolation rooms is desirable for patients requiring aerolization procedures, which include intubation, suction, and nebulization. These rooms may have standalone air conditioning, and they should not be part of the central air conditioning. If air conditioning is not available, negative pressure could also be created through putting up 3 to 4 exhaust fans driving air out of the room. What other considerations should healthcare workers keep in mind when setting up or monitoring an isolation area? Ensure regular cleaning and proper disinfection of common areas. Visitors to the isolation facility should be restricted. For unavoidable entries, visitors should be instructed on and using PPE according to the hospital guidelines. They should use hand hygiene practices prior to entry into and exit from the isolation area. Visitors should consult the healthcare worker in charge before being allowed into the isolation area. Keep a rota of all staff working in the isolation areas for possible outbreak investigation and contact tracing. Keep a record of the visitors too. Doctors, healthcare professionals, and paramedics posted to isolation facility need to be dedicated and not allowed to work in other patient care areas. Remember, you should always wear the PPE before entering the isolation ward and properly remove it after leaving the isolation ward.